Alright guys, let's get busy talking about LSD. Now LSD is going to be the abbreviation for the very tricky to say lysergic acid diethylamide. However, I want you guys to really be on the lookout for that really long name because sometimes test writers won't write it as LSD in answer choices or in question stems. They'll use the full word. So go ahead and be like having your brain on alert for that abbreviation LSD within that really tricky long name. Now, when it comes to our mechanism of action here, it's going to be 5-H2A serotonin receptor agonism. That's not incredibly high yield, but it may be asked sometimes on test day. I think what is more high yield about LSD is how patients present. And it's pretty classic and it's pretty easy to differentiate from any other substance misuse that we may see. So we're going to see hallucinations, and these are classically going to be visual and auditory. So you may have patients saying like, wow, this music sounds so interesting and it's so beautiful. And I see like lines and colors and waves on the wall of the exam room. Everything seems to be moving. This is the type of vignette you're going to get in a patient who's presenting with LSD intoxication. Additionally, you're going to have distorted perception of time and space, and you can also see some depersonalization and derealization. And remember, this is what happens when patients kind of are seeing themselves like from third person. So like imagine that you have a camera that's kind of looking down on you. That would be your view of yourself, almost as if you're playing like a third person video game and you're like watching yourself like run around in an environment. That's like a classic LSD patient. They're like, yeah, I'm like running around the Valley of the Forge and I see all these cool, amazing colors. This is the type of presentation you're going to get in a patient who's on LSD. Additionally, all of these hallucinations and strange stimuli and strange perception can lead to like anxiety and paranoia because this is just truly far from what a patient's true reality is. Additionally, patients may mention that they have flashbacks or realizations. Now, one physical exam finding that may point out LSD is going to be mydriasis, and we need to be able to differentiate this from our patients who are presenting with cocaine or amphetamines because they are also going to have mydriasis, which is going to be dilated pupils. At the end of the day, when it comes to recognizing LSD on test day, it's really going to be these 3 bullets that you really want to focus on. And in terms of management, it's just largely going to be supportive care. We're not going to get a lot of questions about management for LSD on step 1.